Hi, my name is Dr. Joseph Yazdi. I'm a board-certified neurosurgeon with over 20 years of experience. My goal with this video is to provide a complete reference guide for you about your surgical procedure. I will explain to you why and how your surgery is performed, review the risks and benefits of the surgery, and other treatment options to consider. We will also discuss your post-operative care. I hope that this video will be a recreation of your office visit and a good reference guide for you, your family, and your friends. The typical reason to come and see me is for back and buttock pain with radiation, sometimes into the groin and sometimes into a nondescript way into the thigh. By the time we're talking about surgery, that means you've already had physical therapy, chiropractic treatments, and some injections, and they did not work. Now we're looking into surgery as an option. The most critical part of surgery decision making is to make sure we have the correct diagnosis. Because of its location and function, the sacroiliac joint can mimic your lumbar spine issues or even hip issues. So we have to rely a lot on history, physical examination, and especially how you responded to your sacroiliac joint injection. If they seem to all correlate, then you should have a very good result with your surgery. As a side note, I see a lot of patients who have failed lumbar fusion. It turns out that they actually had sacroiliac joint problems, but they were misdiagnosed. The main culprit causing your sacroiliac joint pain is a little bit of extra movement between the sacrum and the ilium, which is your main hip bone. That little tiny bit of movement is what causes irritation of all the nerves around this joint, and that leads to your symptoms. The goal of surgery is to fuse these two bones together and eliminate that movement. That's how we get rid of your pain. During surgery, we make a small incision just lateral to the joint itself. We expose this part of the ilium and we put 2 screws right through it, through the joint and into the sacrum. We pack the screws with crushed bone and other material that will help you make bone, and that will eventually lead to a fusion. So this is a typical X-ray after this procedure. As you can see, this is the sacroiliac joint over here, and we've put 2 screws across it. This is on the right side, and this is on the left side. Again, the sacroiliac joint, and 2 screws going across it. So what are the risks of surgery? There is risk of bleeding and infection, just like any other surgery. The other risks are all related to working on and around the nerves. Those include weakness or paralysis, numbness, loss of bowel and bladder function, and that surgery may not resolve all your symptoms. The chances are low, but never zero. You will typically be discharged home within a few hours from surgery. As for postoperative instructions, I would like to keep the dressing on and dry for the next 2 days. Then you can remove it and take a full body shower. But I would like you to avoid taking a bath or soaking it in a pool. I want you to keep lifting less than 10 pounds. You may walk or go up and down the stairs as long as you're comfortable. I will see you back in the office at 2, 6, and 12 weeks from surgery, and we will get x-rays periodically to make sure that everything is not only in good position, but that the healing is coming along as expected. You may get some physical therapy or chiropractic treatments after surgery. It will depend on a number of factors that we will discuss. Most patients typically go back to light duty work at 6 weeks and heavier work at about 3 months.